Do you know in 2024 we are going to use new SCC codes? If you are working as a SCC coder, you need to know what are the latest changes we are going to have in 2024. In this session, we are going to know differences between version 24 and version 28. I am Harish, medical coder, process trainer, content creator for Fastcoder 21 free medical coding YouTube channel. In my channel, you will get IC10 CM latest updates, CPT latest updates, HICPICS latest updates, as well as free APCs CU webinar information. If you want to know differences between version 24 and version 28, please watch this video until the end and also like, comment and subscribe in order to motivate me to provide more valuable education sessions. So today our topic is 2024 SCC updates, version 24 versus version 28. First, we will start with the few basics. So first we need to know what are SCCs. Usually SCC means hierarchical condition categories. Otherwise we will call it as risk adjustment coding or SCC coding. As all of us know, in SCC coding we will use only IC10 CM codes. Now we know what are SCCs and risk adjustment coding. Now we need to know why do we use SCCs. So basically these SCCs are used by Medicare to establish monthly rates to Medicare Advantage organizations for MA patients. So in order to provide monthly rates to Medicare Advantage organization, Medicare established SCC condition categories or SCC codes. As all of us know, SCCs are varies payment by demographics, geography and diagnosis. So basically we need to understand here that SCCs are not common for each and every patient. So these SCCs are varies based on demographics of the patient, geography of the patient as well as the diagnosis of the patient. As all of us know, so far we are using version 24. Now we need to know conditions not included in version 28 which we are going to use from 2024. So conditions not included in version 28 are conditions that did not accurately predict costs. So the condition which are will not predict the cost accurately, those are not included in version 28. Coefficients were very small here. Conditions were uncommon. So where there are conditions are uncommon, they are not going to include it in version 28. And also condition which are not having diagnostic coding criteria. So codes in version 28. So number of SCC categories increased from 86 to 115 in 2024. In 2020 version, we have only 86 SCC categories. In 2024, we have assigned risk codes to only 2294 codes. And also, we also know that SCC categories were currently developed based on ICD-9 CM, but version 28 based on IC10 CM. So you need to understand here that so far or currently we are using ICD-9 CM SCC categories, but from 2024 we are going to use IC10 CM SCC categories which are based on version 28. So all the version 28 categories or diagnoses are used by IC10 CM. So version 28 additional condition. 268 codes that did not map to an SCC category in version 24 will map in version 28. So as we all are know that in version 24 few codes are not mapped to SCC condition categories, but in version 28 we are going to have those 268 codes into SCC category, which are from chapter 16 and chapter 17, and the conditions which do not represent condition common in Medicare patients. These are also included in version 28, and these conditions will help for risk scores for commercial groups. So now we will check SEC differences between current and proposed CMS SEC risk adjustment models by disease group. So if we check here, as all of us know, 2020 model uses version 24 and proposed model version 28 we are going to use in 2024. In version 24 we have 86 payment HCCs. In version 28 we have 115 payment HCCs. In version 24 we have nearly 10,000 codes, but in version 28 we have nearly 8,000 ICD-10 CM codes. If you compare infectious disease 3 HCCs, those are common in version 28 also. For example, if you compare neoplasm disease group, we have 5 HCCs version V24, but we have 7 HCCs in version 28. As we have discussed previously, HCC categories are increased. If you see here in diabetes group also, previously we have 3 HCCs, now we have 4 HCCs. Metabolic disease we have 3 HCCs, and in 2024 or version 28 we are going to have 4 HCCs. And as well as in liver disease group we have 3 HCCs in 2020, and 5 HCCs in 2024. For example, if we take gastrointestinal disease group into version 24, we have 3 HCCs. In version 28, we have 5 HCCs. If we take musculoskeletal disease group, we have 2 HCCs in version 24, whereas in 2024, we are going to have 3 HCCs. So most of the additional HCCs are included in blood disease group. In version 24, we have only 3 HCCs, but in 2024, we are going to have 7 HCCs, which are HCC 107, 108, 109, 111, 112, 114, and 115. So there is a huge increase in the HCC in blood groups. And we have cognitive disease group. Version 24, we have 2 HCCs, and version 20 we have 2 HCCs, 24 2 HCCs. In version 28 we have 3 HCCs. So if you check substance use disorder disease group, in version 24 we have 3 HCCs, in version 28 we have 5 HCCs. Whereas in psychiatric disease group, in version 24 we have 4 HCCs, in version 28 we have 5 HCCs. For example, if you take schizophrenia here, as in version 24 we have HCC 57, but whereas it is changed to HCC 151 in version 28. If we take spinal disease group, in version 24 we have 3 HCCs, in version 28 also we have 3 HCCs. So there is no change in the spinal disease group. If you take neurological disease group, in version 24 we have 8 HCCs, whereas in version 28 we have 12 HCCs, which are the common procedures or common condition we will see in the SCC coding. So these all are included in neurological system. So in version 24 we have more in neurological system. So if you take arrest disease group, we have 3 HCCs in version 24 and 3 HCCs in version 28. For example, if we take heart disease group, we have 5 HCCs in V24 and we have 10 HCCs in version 28. Guys, I hope this session is very important if you are working as a HCC coder. As a HCC coder or risk adjustment coder, you need to know the differences between version 24 and version 25. So if you have any concerns or any suggestions, please send it to vincentmedicalcoder@gmail.com, and also please like, comment, subscribe and share Passcode 21 in order to motivate me so I can provide more valuable information in order to get succeed in medical coding field. Happy coding, guys.